Hello, everyone. Welcome back. We had such a fun time talking. Dr. Gibbs and I are going to talk again about more eye allergies and sinus allergies. And just a reminder, I'm Shilpi Pradhan, board certified ophthalmologist in Richmond, Virginia. And this is Dr. Gibbs. Go ahead. Take it away.
Hi,
Introduce yourself.
I'm Dr. Dana Gibbs. I am a board certified otolaryngologist and ENT allergist in Dallas and Arlington, Texas.
We learned so much from you last time. I was so happy to learn so many things about sinus pain. And if you guys missed that last interview or discussion that we had, please check it out. But we're going to go on to part two, where we're going to learn some more about more eyes and eye itching, and then supplements for the sinuses and eyes, which is our goal today.
So exciting to be back. I'm very pleased that you invited me again. Anyway, just wanted to recall ophthalmology and otolaryngology were one specialty up until about 1979, when it got to where there was just too much information for one person to learn everything. So they're now two incredibly intertwined and related specialties, but
that's a great point.
Now separate.
And you said it was 1979, so not
too
long ago.
It wasn't that long ago. And I think back when I was training, I started training in 94, and there were still all kinds of eye, ear, nose, and throat doctors out around at the time. So some of the stuff I learned from them. So it's very cool.
Oh, neat. I wonder if do you think the ear, nose, and throat part will ever split further, or no, too intertwined?
Wow. I kind of hate that specialties are breaking up into smaller and smaller chunks, because I think that there are entire sections and pieces of medicine that are kind of getting dropped off and dropped out because nobody subspecializes in them. So there's a lot within allergy that I feel like gets completely ignored by the allergist immunologists. And then, they say, oh, well, that's a sensitivity disorder. That's not allergy, so I don't have to do it. And I kind of feel like part of my mission in life is to bring back to recall that just because something is a sensitivity disorder and it doesn't get called allergy doesn't mean that staying away from it won't enhance your life and make you feel better. And so I kind of feel obligated to help my patients with things like, oh, well, you have a dairy sensitivity. And I know we talked a bit about headaches last time, but that was one of the things that really struck me, was that you were talking about eye pain and headaches. And I have actually gone so far as to do sinus surgery on people who had eye pain and headaches, and it turned out to be a food allergy. And it was just like, I felt like I had, on the one hand, I helped them figure it out, but on the other hand, I didn't figure it out until after they had had a painful and expensive surgery that didn't do them any good. And so just...
oh my gosh, I just absolutely love what you brought up, because I'm such a huge allergy. So, personally, you don't know this about me, but I am almost vegan. I'm like 90% vegan. And, I have dairy sensitivities and sensitivities. I've been gluten-free for years and years.
Okay.
I totally tell my patients who have eye pain and chronic sinus issues to go dairy-free. And they look at me like I have...
Yes, absolutely.
Please, just try it for a month.
Try it for a month, yes.
Then you don't have to keep doing it, but please try it for a month before you undergo. Like you said, I had a patient, oh my gosh, I can't remember how old she was. I think 50 years old. She had thyroid disease, exophthalmos, her eyes kind of bug-eyed. She had
she had Graves' disease
surgery.
She my goodness.
Sinus disease surgery, and she still had chronic sinus, eye pain.
I hate eye pain.
She also had narrow angles, and I have laser.
Oh no.
peripheral iridotomies to prevent glaucoma. And her,
Mm-hmm.
the funny thing was when I finished her second eye laser, she actually said that she could smell again. And I was like, what are you talking about? She's like, I haven't been able to smell for years. So my peripheral iridotomies for treating her narrow angle and high eye pressure returned her sense of smell. Anyway, that was like 5 years ago. Most recently,
Wow.
I forgot about that until you just said that. But most recently, she was talking to me. She came in for her annual eye exam. She's telling me all this sinus pain and sinus allergy. And I was like, please go dairy free for a month. And I called her a month later and I was like, hey, how are you doing? And she's like, you wouldn't believe it. I have not had
Yeah, I would.
pain. And I was like, thank you. She's like, I'm staying dairy free. So do you want to, we haven't talked about talking about this, but I love food allergy discussions. Do you want to
Oh
talk
my
more
gosh.
about dairy and sinuses?
Oh my gosh, sure. Okay, so there's an old saw, maybe your grandmother said it, or maybe my grandmother said it, that milk makes mucus. Well, I don't know how that works exactly, but it's true. And so anytime somebody tells me I have this post-nasal drip or they're clearing their throat all the time, then I'm like, you have a food sensitivity and you can call it whatever you want to call it. If taking that food out of your diet makes you feel better, why not call it an allergy? The patients understand what allergy means. If you say, oh, I have a sensitivity, they're like, oh, what does that even mean? But milk from a cow is full of a very large number of different complex proteins, any one of which or many of which can have various immune reactions in your body. And your GI tract has 70% of the immune reactive tissue in your body. And if those molecules react and get absorbed in your bloodstream, they can go anywhere. They can cause anything from joint pain to headaches to snot in your nose to congestion to dry eyes, probably, I don't know, to behavior issues and mental status, depression. I've seen in 22 years of doing this, I've seen it all. And it's not just dairy, but it can be anything that you eat a lot of every week. I've seen it be eggs. I've seen it be onions. I've seen it be beef. I've seen it be chicken, sesame seeds, pepper. I've seen it all.
When you bring up beef, so I don't eat beef, of course.
Okay, well,
mostly,
if you're vegan, I guess not.
But when you bring up beef, I think of the alpha gal, is it tick-borne or some sort of
yeah, the alpha gal antibody. That's it's a tick-borne.
Does it cause sinus problems too? Just curious.
No, it causes anaphylactic shock.
Okay, much worse.
Which is worse. I haven't seen alpha gal cause any particular sinus disease. I think the patients who have it have much more serious problems to worry about than whether their nose is stuffy.
What about gluten? Does that cause sinus problems? Because I want to talk about gluten and eye disease just briefly after you go. Go ahead.
Okay, so yes. And there are all kinds, that's a very complex topic because gluten made from American dwarf wheat treated with, now my mind is blanking, Roundup, what is it? What's the name of that chemical?
DEET? Is it DEET? Or
no, glyphosate. Glyphosate is the chemical name for Roundup. So, in the industrial food production in the United States, the companies are allowed to pre-treat the fields with Roundup so that they don't have to deal with weeds. And the big food companies and the big chemical companies have really kind of gotten that push through Congress that it's okay to have that. So that's not an allergy, that's a toxin. But I see patient after patient that's like, oh, I have to be gluten-free. And if I go to Europe and I eat the bread over there and I eat the pasta over there, I can eat it and I'm fine. And the main difference is the variety of wheat and the fact that Europe they're not allowed to treat their food with glyphosate. So even though that's not an allergy per se, that's huge. And so if you go, some people who think they have a gluten sensitivity, it's like, well, you can have organic wheat and maybe you can have einkorn wheat or one of the other varieties of wheat, and maybe you're not as bad. But if you have a true gluten sensitivity, and gluten is once again, it's not a single protein, it's a series of proteins. Gliadin is one of the other ones. And if you have that and you make IgE, that's a kind of antibody that's a specifically produced chemical in your body that tells your body to attack that whatever protein it is. If you make IgE antibody against gliadin and gluten, then that's when you have what's called celiac. And people think, oh, celiac is just a gastro problem. Well, that's not true. Celiac can affect your joints and your brain and everything in your body. And so people who have that, positive IgE to gluten, I'm like, you should never eat this, ever, 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 ever. Your risk of all-cause death doubles or more if you eat it. And so it's a real serious problem. But there's lots of gradations below celiac disease that are still wheat protein sensitivities. And all aside from the fact that eating a lot of processed grain puts you at risk for metabolic syndrome and diabetes and all the other stuff. So it's important to figure out by an elimination diet what effect that has on you. And you can do an elimination diet as quick as 7 days. You can say, okay, I'm going to take it out for 5 days, and then I'm going to sit down and I'm going to eat a bowl of cream of wheat on Saturday, and then I'm going to eat another one. And if I feel fine, then you might be okay, but you also might not. And then if you're still not, then you may need to do a 4 or 6 week elimination. So that's a huge topic you brought up there.
It is, but I love talking about gluten, but we won't talk about it too long, but I'll just share some personal tidbits and then tidbits.
Sure.
So you had mentioned the gut flora and how it absorbs all these. And it really is our body's first line of defense. The skin is the outside. Last time we talked about all the allergens on the skin.
Yes.
And then on the inside, it's really our gut, our gut bacteria and gluten. If you truly have celiac or a sensitivity, even I explain it to patients like you have these microvilli in your intestines and that are supposed to absorb all the nutrients. And if you have a gluten problem, it just kind of smushes them and then you lose all of them and you don't absorb your nutrients and you're at much higher risk for infection. Your immune system is just tremendously weakened. It's not just like a little bit weakened. So your gut has to protect you. For me personally, I've probably suffered from gluten intolerance, or maybe I have celiac. I've never been tested for 20 plus years, but my doctors diagnosed it as irritable bowel disease. And
that term kills me.
I suffered for years and years. It's also linked to infertility and miscarriage, both of which I've suffered from because of gluten when I didn't know any better. Even being a doctor, I didn't know.
No, nobody tells you these things. They didn't tell us this in med school. No.
So that's why I love talking about gluten. But for I don't know anything about it for sinus allergy, but definitely for the eye, there's a condition called uveitis. Uvea is the colored part of your eye, so it's the iris and the ciliary body, and then the choroid layer under the retina. So any of the 3 parts of the uvea can be inflamed, and it's called uveitis.
Okay.
Most common, it's iritis, or the anterior part.
Mm-hmm.
And I'm sure you know, there is a condition, ankylosing spondylitis, that has HLA-B27 that's positive in the system. But that, if you search on PubMed.gov, for some reason, there's an interaction with gluten for that one. So patients who are HLA-B27 and have uveitis and have gone gluten-free actually can control their uveitis and iritis much better than if they continue to eat gluten.
Right.
Same thing with scleritis as well. I've
Okay.
had it happen for a couple of patients with scleritis. And that's overall inflammation. I know we were going to get into nutrients and supplements later, but overall inflammation. I had one lady last year or 2 years ago, I can't remember. Since I'm now board certified in lifestyle medicine, in addition to ophthalmology, I love
that's
talking
very
about
cool.
diet and nutrition. But I did have one lady with like bad nodular anterior scleritis, which are these like big red bumps, like your white part of your eye actually gets inflamed. And she had really bad uncontrolled rheumatoid. And I talked to her about lifestyle medicine. This was before I was board certified, and how food can cause inflammation, especially meat and dairy and the casein protein in dairy. And
yes,
I had no idea, but she went vegan that day. And
good for
back
her.
like a month later, I know, I was shocked. A month. So what we do matters. What we educate patients matters. But anyway, she came back a month later. She had lost about 20 pounds and she was on prednisone. Still, she lost weight.
Wow.
She was on, I think, 3 different medicines with her rheumatologist. But despite being on prednisone, she lost weight because she was vegan. She was eating a ton, and her scleritis was like 50% better. Fast forward another 3 months, she had lost a total of 63 pounds.
Wow.
I have a testimonial with her on my YouTube channel if anybody wants to find it. She's such a sweet patient. But anyway, like, she controlled her eye disease, I think, by just changing her diet
That's
without adding
amazing.
supplements. Although I do like supplements if you can't get it through diet, but obviously your diet is the best place to get your nutrition and your anti-inflammatory things. And then, eliminating, like you said, eliminating the things that are causing your body pain or irritation or inflammation. Why would you not do that? Just listen to your body and eliminate what is causing you a problem.
Right.
My goodness.
It's amazing.
I love this topic. I know we hadn't planned on talking about it, but
no, we hadn't talked. I didn't even know you were interested in that sort of thing. That's so cool.
Do you want to talk more about it, or do you want to get into supplements a little bit?
Just something about dairy that I forgot to mention. We were talking about all the proteins in dairy, but this is some information that I actually was looking up for a blog post that I'm fixing to write, which is that probably 35% of people in the US are lactose intolerant, and probably 70% or more of Asian cultures have a degree of lactose intolerance, which is lactose is the sugar that's in dairy products. It's somewhat less if you're having cheese or yogurt. It's been mostly consumed by the bacteria that make the cheese and the yogurt. But the lactose has galactose, as it's glucose and galactose together. And galactose is a very pro-inflammatory molecule in your body in and of itself, even if you're not malabsorbing it, or even if you're not allergic to it, so to speak. It's still very pro-inflammatory. And so anything you can do to take that out of your diet is probably a helpful and healthy thing to do. And, in the allergy world, where I did a lot of my learning and training, it's milk is for baby cows. That's the deal. So just say that.
I totally agree with you. I'm going to shift gears from what you said to dry eye a little bit.
Okay, yeah.
Because believe it or not, hyperglycemia is linked to worsening dry eye.
Oh, great. So, one more thing.
And I don't know if it's galactose specifically, but just basics on dry eye. Your tears cover the surface of the eye. You need normal quality and quantity to not have dry eye. But so your eye makes, and the lacrimal gland makes the water layer. The eyelids make the oil layer.
Okay.
And the eyelids have two components. They have the eyelash line, and then they've got a little row of little oil glands behind them called the meibomian glands.
Right.
And there's a study that I don't know if it's published yet or not, but I think it is. Oh goodness, it'll come to me in a minute. But he was telling me about how hyperglycemia actually makes the meibomian glands dysfunction more, and so you don't get that oil secreted, and the oil layer of your tear film is missing. And patients that are hypoglycemic or diabetic can be more prone to meibomian gland dysfunction. They may actually have a little bit more neuropathy, so they may not feel that dry eye as much, but they definitely have more risk of dry eye as well. But it's so interesting. Everything is connected. Like you said, we shouldn't split up the different parts of the body more.
No,
because
I think we
you
shouldn't.
do need to, and that's why PCPs are so important, to put everything together, all the specialist reports together, and help take care of your health. But back to kind of like seasonal. Anyway, I just wanted to throw that out there because you mentioned the galactose as inflammatory, and maybe it's the galactose that's inflaming the meibomian glands. I'm not sure what part of the hyperglycemia is actually affecting those glands.
Yeah. Well, I mean, galactose is specifically a dairy sugar. So I don't know if it's
split it up into like patients who are vegetarian, vegan, and like non-veg, no omnivores, and what that would be an interesting study for the future.
Yeah.
Wow.
But just elevated, but his study was just people with elevated blood sugar have more inflammation of the meibomian glands.
As far as I can recall, gosh, I'm so blanking on the name. I'll have to look it up for you later. But yes. Anyway, let me tell a little bit about the eyelids a little bit more. So people might have heard the term blepharitis.
I want to talk about that.
It's a long word that just means crusty eyelashes.
Okay.
But actually, there's two different types of blepharitis.
Well, wait, I woke up with that this morning.
There can be normal blepharitis, maybe normal crusting, but it's so interesting. We call it anterior blepharitis and posterior blepharitis. So anterior is crusting eyelashes, actually, and that's the most common, what people talk about blepharitis. Posterior blepharitis is those oil glands getting clogged up and having dysfunction, getting shorter, not producing the oil. But let's focus on anterior blepharitis because patients have crusty eyelashes and they think they have eye allergies. And they're taking all these allergy eye drops and it's not working.
Right.
And really they have an infection. So there's two types of anterior blepharitis. There's just kind of like skin squamous infection of the eyelashes. And then there's Demodex, which is a little mite. I think it's in the arthropod family because it has 8 little legs that lives in your eyelashes, and it can also live on your skin. And it can cause crusty eyelashes, and you can spread it from person to person. You can spread it from hotel rooms. You can, oh goodness. But I see a ton of Demodex, which is misdiagnosed as regular blepharitis or allergy, and it's not treated properly because no one's looked at the lashes looking for the telltale signs of the collarettes and the little egg sacs of the little mites.
So that's what I was going to ask is, so you can see those if you look at the eye under a microscope.
Yes, you can. And patients, if they don't believe me, in my office, I actually, I offer for anybody that I'm diagnosing this with, if they're not too squeamish, is I'll pluck an eyelash, put it on a slide, and show them the little mite moving around on the slide on the microscope in the office. So then they're like, oh, okay, tell me how to treat that now.
Right, exactly. Give me something to treat this.
Yes. If you go to like rosacea.org, the rosacea with the skin redness and cheek redness, nose redness, it says a lot of rosacea is also caused by Demodex, which is so common. I think
did not know that either.
Some studies say that like 70 to 90% of us have some level of Demodex all the time.
Oh, wow.
I'd say my patients, about 30 to 50% of them have Demodex. Some have no symptoms and they don't want to treat it. And some have those crusty, itchy eyelashes and they think it's allergy. Worst case scenario, that inflammation from the mites or even regular crusting can cause the oil glands behind them to get clogged up, and then you get a stye.
Okay.
And then a stye is like a bump. It's like an infection of an oil gland, but it becomes huge, kind of like a huge pimple in your eyelid.
Yeah.
And if you don't treat that soon enough, it can become a preseptal cellulitis where the whole eyelid is infected, which obviously can, if you're at higher risk, and can spread to the orbital and become an orbital cellulitis.
That would be even worse.
So just from a little mite or skin, eyelash itching, crusting, you can have all sorts of complications. So don't ignore your symptoms and treat them.
So
see your ENT doctor and see your eye doctor and get the right diagnosis.
So this is just a thought, and I have not ever investigated this before, but dust mites, the D. pteronosinus and D. farinate dust mites that live on dead skin cells in your pillows, in your carpets, are one of the most common things that people are allergic to. And it just occurred to me, what if people can be allergic to their Demodex?
I have not thought about that.
And
possible.
And that would make things
worse.
Even worse. but no, that just occurred to me as a wow, what if? I wonder. So
it's so interesting. I mean, there's so many, we could talk for hours, but there's so many like periocular diseases, atopic dermatitis and those do cause inflammation of the lid margin, the meibomian glands and whatnot. So goodness, we can talk about that for hours, but let me just say basic lid hygiene that I tell my
patients. Please tell me what to do.
Eyelashes. I know there's a popular discussion in the years past of using baby shampoo to clean your eyelashes. That's okay. Some people, it can be really irritating, but make sure you dilute it with water if you're going to use baby shampoo, and then scrub. No rubbing, just a gentle scrub of the lashes and wash off. But there's a bunch of nice eyelid cleansers, like AccuSoft makes a few in the drugstore. There's a few other brands. I love one from IECO that is a tea tree cleanser. They have a 1% and a 2%. The reason I love it is tea tree, it definitely helps kill the Demodex. There is a wipe. There's a bunch of different wipes, but there's a wipe called Demodex Oust by the AccuSoft company that has a stronger concentration of tea tree oil that you can clean your lashes with. There's an interesting company called Zocular with a Z that makes wipes that have a component made out of okra that helps kill mites and clean your lashes. And some of my really sensitive eyelid sensitive patients who can't tolerate any tea tree, like the Zocular wipes, which you can buy online. So there's the cleansing step, and then there's kind of a sterilizing step. There's hypochlorous acid, which can buy prescription. There's a few different brand names like Avenova or Acuisin, and then there's over the counter. They're all the same. Truly speaking, hypochlor is one of the over the counter ones, and basically you spray it on a cotton round and wipe your eyes with it at night to kind of sterilize and kill all the skin bacteria I have had patients with chronic styes over the years, and once I put them on kind of just like a basic cleansing regimen with the hypochlor, then they don't get any more styes. So because they're keeping their eyelashes clean. Maybe they weren't doing it before, who knows, but it really does help. And then if you actually have mites, Then you want to, I offer procedures in my office where I debulk the mites with a little machine that is like a motorized Q-tip, and use forceps and actually physically pluck off as many mites as I can.
Wow.
And then there's a prescription cream that I love using for mites because it kills them. It's Ivermectin Cream, or brand
Okay.
name Sulantra, which is FDA approved for rosacea. So it's not so interesting. There's an anti-parasite cream that is FDA approved for rosacea. That tells you what the rosacea people are saying, that Demodex does, make rosacea worse and can cause rosacea. And there's also procedures like IPL, or intense pulse light, that I do for dry eye to help the oil glands flow better. But
Mhm.
IPL kills mites. So
Yeah.
I love
It's
doing
ultraviolet, I
IPL
guess so.
for rosacea, facial rosacea,
Mhm.
as well as eyelid inflammation.
Very cool.
Sometimes, go ahead. Were you going to say something?
No, that's very cool. I didn't know any of this stuff, so that's awesome.
Oh, I love IPL. It definitely helps kill mites. I even use it for Stye. So if a patient has a Stye, and especially, well, it works for acne anywhere, but if they have like an important event, or it's really, really painful, and I can just zap it with the IPL a couple of times and it will settle down so much faster than just topical antibiotics and heat. And so IPL is great. It's a great adjunct to my clinic for styes, chalazions, Demodex, rosacea,
Wow.
and dry eye disease, especially with meibomian gland dysfunction. So
Yeah.
love, love, love IPL. The fact that it's out there and available to us to help patients. I was going to mention, I do get some insurance denials for the ivermectin cream, which is sometimes frustrating, that insurance companies are trying to dictate my patient care and they want me to try oral ivermectin first, or oral ivermectin plus a bendazole, or some of these other anti-parasite oral medications. And I'm like, first of all, they don't work. I've tried them over the years on
Mm.
patients. But secondly, oral medications have stronger side effects, and this is
Side
a
effects. There you go.
localized topical process. And I just wish insurance companies wouldn't dictate our care as much, because when they approve that cream, it helps that patient so much to get rid of those mites and get rid of those crusty eyelashes
Hmm.
and prevent styes and all the other things that could cause medical expenses or expenditures for that patient, and lost time at work, from eye irritation or a stye or an eyelid infection. Or anyway, let me get off my soapbox about insurance.
About insurance. Yeah, we could talk all day about insurance denials. Oh my goodness.
I
Drive
also want
me
to just
crazy.
talk briefly about supplements for the eyelids, because we're talking
Great.
eyelids here. Omega 3s are one of my favorites, and there's so many
Oh
different
yeah.
kinds of omega 3s. But um, I know you mentioned dementia before. DHA is one of the omega 3s that helps dementia even, but
Hmm.
DHA and EPA have been shown to help tear production and help the meibomian glands flow and make better oil for the tear film. So those can
Very
also
interesting.
help prevent styes. I'll tell you a few stories of kids. I had one 7-year-old who had this
Hmm.
large bump here for 2 years.
Oh my goodness.
And the parent brought him to me and they were like, well, he's had it for 2 years. We don't really want surgery, but is there anything we could do? And I'm like, you've done the heat, you've done, everything else. I put them on omega 3s. I use the PRN brand and I sell it in my
Hmm.
office. I put him on liquid because he's, 7. He's not going to take a pill.
Hmm.
Put him on liquid, half a teaspoon per day. And that was the first time I had tried it on a child. And
Hmm.
slowly and slowly, this little bump like worked its way down the eyelid and went away. In 3 months, it was gone.
Wow.
It had been there for 2 years. In 3 months on oral omega 3s, high concentration, and a good
Hmm.
quality omega 3,
Yeah.
like the PRN brand or Nordic Naturals brand, it was gone. And I've tried it on a few other kids and it definitely works. Omega 3s help prevent and treat styes and eyelid issues like that.
Very cool.
Help dry eye tremendously. What else was I going to say? Oh, I had another little 4-year-old with 3 out of 4 eyelids with styes
Oh
and
my
little red
gosh.
bumps all over her face. And her mother called me. She was actually my very first patient of my practice over 5.5 years ago. And
Mm-hmm.
her mother's like, "You're the only surgeon at network. Can you please do her surgery?" And I was postpartum. I opened my practice 2 weeks early just to see her. And I looked at her and I'm like, "You don't need surgery. You need Demodex treatment." And
Oh my gosh.
we treated her Demodex. All her bumps went away. The facial bumps went away. Her eyelid bumps went away. It took about 2, 3 months, but she had been suffering again for probably 6 or 8 months before she had seen me. All the other eye doctors had told her, "You need
That she needs
surgery,"
surgery.
and we're not diagnosing or treating the Demodex appropriately. So sometimes these chronic bumps just need the proper topical treatment for the Demodex, like I talked about, and omega 3s, and
That's
improving our
fascinating.
whole nutrition, even in kids
Right.
and adults, can help prevent so many problems. What are your thoughts on omega 3s for the sinuses and ear, nose, and throat, and
You
any
know,
other?
I don't know specifically that they dramatically change the sinuses in particular. I don't think there's any studies particularly saying, oh well, omega-3s this and that. But there are so many other great reasons to take omega-3s that I'm just like, why would anybody not take omega-3s? Why would they not eat ocean fish? Why? I don't see any reason that that you shouldn't. Just, it's anti-inflammatory. It helps you not have blood clots. It is works against dementia. There's just so many reasons to take it. And so, no, so while I don't know particularly ENT reasons, I would say absolutely it's the right thing to do.
There's a couple of I don't know if you know about the omega index. I learned about that about 6, 7 years ago. It's an
Mhm.
interesting number. It's a blood test that measures the percent saturation of your red blood cells with omega 3s. And
Mm.
we do it in our office, or you can order a kit from omegaquant.com, I think, and test it yourself. But and they talk about if your percent saturation is less than 4%, it's about 10 times higher risk of heart issues. And if you're in the ideal range, which is over about 7 to 8% or higher to 12%, then you're protected. And although there's no studies that I know of for omega index and dry eye, patients sometimes come to me taking various supplements, and I'm like, well, let's see if they're being absorbed. Let's see if they're working, because
Mhm.
there's always a discussion like, what is the best brand of omega 3s? And
Mhm.
obviously I'm a big supporter of PRN and Nordic Naturals, but
Mhm.
to patients, I have them do the omega test, and if their levels are still 3 or 4, whatever they're taking
Isn't
is
working.
not
Yeah.
good and is not
Not
working
good
for
enough.
them and is not being absorbed. So,
Mhm.
but for heart health, it's super important to take omegas. And you mentioned fish, so I do take a fish source of omega 3s, but
Mhm.
I've been debating and considering switching to a more vegan source. And some of the vegan
Mhm.
alternatives would be like flaxseed, chia seeds, hemp seeds.
Mhm.
There's algae based oral omega supplements. So there's so many. We live in a wonderful time with all these companies
Neat
taking the
things.
initiative and making even vegan friendly omega 3s,
Mhm.
which still help our body so much.
Yeah. Well, I didn't even realize there were vegan alternatives, so that's fantastic.
The PRN company that I sell also
Mhm.
makes a vegan omega as well, that I have in the office as well. It's not as high of a concentration of omega 3s as the fish one, but
Mhm.
it helps. It certainly helps.
That's fantastic.
The other topical thing I wanted to talk about for blepharitis was uh, Vaseline and castor oil, which are
Okay.
not talked about, but they're commonly available. Vaseline everybody probably has in their house, and then castor oil, if you get the cosmetic grade, organic, hexane free
Mhm.
castor oil. I have some dry eye patients put that on their lashes, and some of my Demodex patients even who cannot tolerate tea tree oil cleansers or
Mhm.
the Cilantro Ivermectin cream. I just have them use it to help their dry eye and try to drown out drown out the mites. I don't know if there's
Drown them. Yeah.
probably no studies on that, but it does help. So
That's very cool. So are there other supplements that you recommend? So for example, like I've heard a lot about lutein and zeaxanthin, not for eyelids in particular, but for sorry, my mind is now
no,
blanking.
I will take over. Yes,
Please.
so supplements are a huge part of my discussion with patients. One, I'm always talking to them about lifestyle medicine. If they're a diabetic, they come in for an eye exam. I'm going to talk to them about Dr. Neil Bernard and Physicians Committee for Responsible Medicine, his wonderful organization, his books on how to reverse diabetes through diet. But back to your question, the lutein and zeaxanthin were kind of hit the scene, I think, after the AREDS 2 trial came out in 2012. It was an NIH sponsored trial. ARED stands for Age-Related Eye Disease Study, which was a study for macular degeneration. So
Right.
Macular degeneration is the number one cause of central vision loss in the older population. And it can be permanent if it's not treated properly. So
Right.
for pigment in the retina, a lot of it is lutein and zeaxanthin. And as we get older, our bodies normally, when we're young, we absorb it through our diets, especially through the green leafy vegetables like kale and spinach. And kale is the highest, I think. But as we get older, we don't absorb it as well. And part of it has to do with gut health. Part of it has to do with other micronutrients like zinc that I think is needed almost as a catalyst to help absorb the lutein and zeaxanthin. So the studies, showed that supplementing reduce the risk of progression if you had macular degeneration, not if you don't. So if you actually have dry macular degeneration, it helps prevent the progression to wet macular degeneration by over 25% over 5 years. So the AREDS 2 formula is very specific. It's got vitamin C, E, zinc, copper, lutein, and zeaxanthin. I think it has magnesium too, but there's a page on my website and links to the NIH, and you can look up the exact formula. But very important, especially if you have dry macular degeneration, to take those supplements because they help prevent the progression. The other big one that's related, it's not a supplement, but it's something that hurts you, is smoking. Smoking is so linked to, I'm sure, allergies and sinus issues, but so linked to progression of macular degeneration and progression of glaucoma, like two diseases that can cause vision loss. So if you're a smoker, please quit smoking. It does nothing good for you, and it can cause so many eye issues. And I'm sure, obviously cancer, lung cancer, colon cancer, all the other cancers throughout the body. But so in addition to taking supplements or absorbing it through your diet, if you're younger, don't hurt your body, like what we talked about, eating dairy if you're sensitive, or eating gluten if you're sensitive. Smoking is worse than those, for sure.
Worse than those, yeah.
It just does harmful things to you. Do you want to add anything there?
No, smoking would be another whole 8-hour topic if you wanted to talk about oral cancers and progression of sinus disease and nasal polyps and everything else that goes along with.
Maybe we should do that. We should have a discussion about smoking, because I would love to hear about oral cancers and smoking. I mean, I think smoking is so bad for you overall, but let's do that. Well, maybe we should wrap it up here.
Maybe we should.
One other supplement, since you asked about supplements, turmeric, and then let's wrap it up. And then you had a list of supplements you like to tell patients about, and we should get together again and talk about smoking and our passion for anti-smoking.
Well, so tell me what turmeric does particularly.
So, I've always heard that it is anti-inflammatory. So a few years ago, I looked it up. I haven't updated my knowledge base since then, but I definitely looked it up at that time, and looking at how it helps just inflammation overall, and it does
Okay.
help. There is not like solid evidence on it, so
Mm-hmm.
it's a kind of medium grade evidence, but I recommend at least 500 milligrams of the curcumin, which is the active component of turmeric, plus the biopurine, which is an active component of black pepper, which is usually sold together in all turmeric supplements. But it helps my patients with dry eyes sometimes that nothing else helps. And they also
Mm-hmm.
notice, that so I'm putting dry eye patients on omega-3s and turmeric, and they notice their
Mm-hmm.
eyes feel better, but they also notice their joints feel better. So
Nice.
definitely evidence out there for its anti-inflammatory properties, even though it's not super strong. I have heard from one patient that their dermatologist said they were more prone to sunburns being on turmeric, which I was not aware of before that one patient. So
I don't know
if you are
about
getting
that.
sunburns and you're on a high dose turmeric, maybe talk to your dermatologist about that. And nothing in too much concentration is good for you
Sure.
anyway.
Yeah.
Every
Overdosing anything's too bad.
any impact of turmeric on sinuses or
Um, Nothing negative that I can think, but I'm just not that experienced with turmeric, so I'll have to defer on that.
and then you have other supplements you recommend patients take. We already
Oh
talked about omegas and lutein and zeaxanthin.
boy, I really strongly encourage everybody, especially people over 40, to take vitamin D3 and to get their D3 levels tested at least one time. Just because I see so many people who feel really sick and ill and awful, whose D3 levels are around 30, which is technically normal, but it's at the very, very bottom edge of normal. And people think, oh, well, vitamin D is just for your bones. But I really think there is an awful lot of evidence nowadays that vitamin D3 is a hormone. It activates your immune system against cancer. Um, and there's a lot of reasons to take it and get those levels up into the 50s. Um, and when you take vitamin D3, you have to increase your calcium intake, and that's the last thing that I wanted to talk about was people think that they're doing themselves a service by drinking milk and getting their calcium that way, but the truth of the matter is that the sugar that's in milk actually impairs your absorption of calcium, and so really milk is not a good way to get calcium. And green leafy vegetables like spinach is a way better way to get calcium. The other thing is that if you want to take a calcium supplement and just take one, that you're better off with something that's cal, mag, and zinc combined um, than just the calcium alone. So those are kind of my pet peeves, and it doesn't have anything to do with ENT directly, but it's just so many people feel so much better when they're taking those versus not taking those. So
So
that's it.
interestingly, for eyes and vitamin D, there were some studies that I read a few years ago that the retinal nerve fiber layer that goes from your eye to your brain can also have some thinning over time if you're vitamin D deficient. So
Oh
it
my
helps your
goodness.
eyes too.
Guess what? More things to know about vitamin D. Yeah, I'd like to put together a
Absolutely.
whole lecture on vitamin D one of these days and just kind of suck in all that kind of disparate data and go, look, everybody needs this. It's just
Absolutely. We could talk for
anyway.
hours. I've learned
Gosh, I know.
so much, Dr. Gibbs. I'm so excited we did this. We need to do it
It
again.
was
There's
super
smoking
fun.
and maybe some other things. If anyone has any comments or questions, you can reach us directly through our practices. Mine is iDoctorMD in Richmond, Virginia. Dr. Gibbs is near Dallas, Fort Worth in Arlington, Texas.
Right?
Uh,
Yeah. And that's just Dana Gibbs MD no, sorry. DanaGibbsMD.com. And you can certainly get on there and shoot me an email and ask me any questions that you have, and maybe that'll become the topic of the next blog post. So
Yep, and we
anyway,
will try to keep helping
this,
everyone and educating and everyone stay out healthy and safe out there, especially
yes,
COVID right now. So
All right.
Thank you, Dr. Gibbs.
Well, thank you, Dr. Pradhan. This has been super great, and let's do it again soon.